Welcome to Weekly Review. I'm Christy Khan. Between June 2025 and March 2026, two non-governmental organizations, Primary Care Education Foundation and DNC Charity Foundation, put the sleep of 73 people to the test, aiming to detect sleep-disordered breathing before it leads to irreversible damage. By using artificial intelligence, participants underwent comprehensive sleep assessments from the comfort of their own homes. The findings are striking. More than half met the clinical threshold for sleep apnea. Even more concerning, most had no idea they were living with the condition. Sleep apnea often develops gradually and can go unnoticed for years. The question is how it can be detected early before the long-term health risks build up. Today we are joined by Julian Yao, a specialist in otorhinolaryngology from Asia Priority Healthcare, who assisted in the study of the Sleep Quality Health Check program. Welcome to the show, Dr. Yao.
Thank you.
So, the NGO is launching the Sleep Quality Health Check program, and why did the NGO decide to introduce this initiative, and how does the program assess sleep quality and identify potential sleep disordered breathing?
This is a very good question, because sleep apnea actually is a very important medical condition that is often left unnoticed by the public population. Even in health check, we seldom perform sleep test for patients to rule out this problem. Our program aims to detect sleep apnea or sleep disorder breathing for the general population and to raise public awareness about this disease.
Looking at the initial findings, and do you see signs of a hidden public health issue?
Yes, from the findings from the participants, there are over 70 participants in the study, and more than 60% found to have meeting the clinical criteria of sleep apnea. So to fill up our medical information, we will usually detect the apnea-hypopnea index, which is AHI, and in short, if it's more than 5, then we will classify it as a mild sleep apnea. Of course, in this study, we are using a medical device in a ring format and let the patient to use it during the sleep at home. It is by no means a formal sleep test in compare with the PSG, which is done in sleep laboratory or in hospital setting.
And is sleep apnea becoming an urban health concern in Hong Kong, and then who appears to be most at risk? And then are there clear gender differences, and what are the consequences if people continue to overlook the condition?
The prevalence of sleep apnea actually is quite high in general. From the study, from the program we have performed, more than 60% have meeting the criteria. In compare with some medical studies, for example, in China, it's around 9% of the general population having this disease. It's more common in men than female, as we can see. Many men are snorer in compare with women. And there are around 2 to 3-fold risk in compare with the ladies. And this is a very common scenario. And patients usually have like snoring, have daytime sleepiness and fatigue, but they usually overlook the issue.
And what are the key health risks of untreated sleep apnea, and at what point does it become life-threatening, and how much of the impact is on long-term quality of life?
Okay, so why we focus on this disease in particular, because this is often overlooked and it really have severe consequences if it is left untreated. For example, cardiovascular risk is the major problem if the sleep apnea is overlooked. It can cause hypertension, which is the most common consequences of untreated sleep apnea, and also it can cause arrhythmia, in particular atrial fibrillation, which is like the heart beating in the wrong rhythm, and also it can cause heart attack, can also cause a cardiovascular problem in the brain, like stroke. These are the major health risks that we can focus on. And also, it causes metabolic issues, just such as obesity, weight gain, and also diabetes. This is this has also an increased risk in OSA patients.
And are you observing a shift in public awareness in Hong Kong when it comes to sleep health? And also, what role does urban living play in poor sleep, and how does that affect performance and family life?
It's a very good question. Public awareness is slowly, this is actually gaining more public concern over the past 10 to 20 years. I still remember, many years ago, there's not much of patient that's really asked about sleep apnea, and some of them have never even heard of the term of sleep apnea. They usually take daytime fatigue and also snoring as a part of their daily life. They think they have too much stress from work. They have a lack of sleep due to maybe family issues or home projects and stuff like that. So, but now they start to realize that daytime fatigue and also sleepiness and poor attention may be due to sleep apnea. So people start to have more awareness, and in a consequence, they will seek medical attention to have a proper test and assessment, and they can therefore have a proper treatment to fix the problem. Many patients, for example, students, they fall asleep in the classroom or during lesson. Teachers and parents just assume that they are being lazy or they don't sleep well at night, but they never realize that actually sleep apnea is one of the medical conditions that can cause a problem.
And what treatment options are currently available for sleep apnea, and what will you recommend? And it's like the study also has pointed to the role of dental professionals, and how do dentists fit into the management of this kind of respiratory sleep disorder?
As far as treatment is concerned, actually this is the role of ENT doctor like us. For patients actually have suspected sleep apnea or already diagnosed, they can actually choose a different specialty to have the assessment. They can, for pediatric patients, they can see pediatric specialists. Sometimes they can also consider see the respiratory specialist. And also, of course, if they consider upper airway assessment and also surgical options, they can choose to see the ENT doctors like us. Treatment options that can be separated into 3 categories. The first is the daily daily lifestyle modification. Of course, don't drink too much alcohol at night. You always snore and have a bad sleep, okay? And also weight loss, okay? Weight loss is very important, and a regular exercise and a proper diet, because obesity always increases the risk of sleep apnea. Many patients that have successful weight loss or they have joined a weight loss program, actually they have their snoring and sleep quality much improved, and sometimes they even cure the obstructive sleep apnea disease by doing weight loss alone. And of course, after the lifestyle modification, we have come to the use of CPAP machine. So this is continuous positive airway pressure machines that can open up the airway during sleep. Patients usually can wear them during the sleep, and they can have a patent airway by the means of positive airway pressure. And finally, come to surgical treatment. Surgical treatment is mainly performed by ENT doctors like us. We will address the obstruction in the upper airways. For example, the tonsil area, adenoid areas, and also sometimes the tongue-based area. These are the common obstructive sites that can cause upper airway obstruction for OSA patients.
But would there be a possibility that the patient didn't really do anything, but the situation just simply gradually got improved when time passes?
That's a very positive way to think about. Most diseases, they don't just go away by themselves. Of course, for maybe a common cold or flu, they will go away. But for obstructive sleep apnea, they just doesn't go away this way, because usually we found that in middle-aged men they have they have more frequency having this disease. Maybe due to weight gain. Usually you gain weight with time, okay, if you don't have a proper lifestyle. And sometimes with maybe the soft tissue, they start to obstruct the airway a little bit more with aging. So actually it is getting more severe rather than less when you grow older. So it's better to have awareness of this disease and therefore seek medical advice a little bit more earlier.
And with rapid advances in medical technology such as robotic surgery, and what role could innovation play in improving the diagnosis or treatment of sleep apnea in the future?
This is a very interesting question. So apart from the common or the mainstream treatment for OSA patients, there are new advances in treating the upper airway. For example, robotic surgery, we call it TORS, T-O-R-S, transoral robotic surgery. By means of a robot machine, we can address the deep structure in the oropharynx or even in the laryngeal region. This can let the surgeon easily assess the difficult areas to open up the airway. For example, removing the tongue base soft tissue to open up the airway. And also, of course, we can also go deeper to the epiglottic area or maybe the tonsil area as well. And apart from that, there's also a relatively new device called the hypoglossal nerve stimulation. It's by means of a stimulation with electricity, they will contract the tongue muscles and open up the airway. Okay, patient usually will receive a surgery done by an ENT surgeon typically, and they have a small device like a pacemaker in the chest. So during the sleep, they will have a stimulation to the tongue muscle and therefore open up the airway. These are the relatively new development in OSA surgeries.
Thanks for sharing your insights with us, Dr. Yao. Stay with us. See you after the break.